Right, so right now we're discussing about the senile changes in taste. But what does senile mean? It means to do with the age. So basically, as people get older, they lose their ability to taste. Not exactly lose, but sort of it decreases. The sensitivity to taste, it decreases. So let's talk about that. First thing first, reduction in the number of taste buds. So the number of taste buds, they started reducing. Progressive loss of taste buds, especially on the tongue. That's one of the reasons for the decreased sensitivity to taste. Degeneration of gustatory receptor cells. Gustatory receptor cells. So here it's very important for me to mention that we have three types of cells in our, tongue. First thing first, we have gustatory cells. Gustatory cells are for taste perception, the taste receptors basically. So these are the receptors. Then you have sporting cells. Sporting cells are present there to maintain the shape. And then you have the basal cells. Basal cells basically have the stem cells. So the taste buds, or not the taste buds exactly, but the taste cells, they have a life expectancy of 10 days. So after 10 days, they fall off. So basal cells come in play because they're stem cells, so they regenerate those stem cells. That's the reason when we're talking about these diseases, I told you that immediately after taste bud regeneration, there can be a sense of hypergeusia. Okay, moving back. Degeneration of gustatory receptor cells. Taste receptor cells become less responsive to stimuli. So these are taste reception cells, so they become less responsive. So reduction in the number of taste buds, degeneration of gustatory receptor cells, decrease regeneration rate. So the regeneration rate gets decreased. Atrophy of lingual papillae. Papillae, particular there are three types of papillae in the in the tongue. One is fungiform, which is in the anterior two-third. Then you have circumvallate, which is posterior at the V portion, and then you have the foliate, which is at the sides of the tongue. So if this is the tongue and this is its posterior region, so this is the circumvallate papillae. Here you'll have the foliate papillae. Here anterior two-thirds you'll have the fungiform papillae. Filiform is also there, but it doesn't have any, significance as such, and it's not a physical papillae. Anyways, moving forward. Decrease regeneration rate, we've covered atrophy of lingual papillae, all of them. Reduced blood supply leads to poor nourishment of taste buds. Decreased saliva secretion. Intestines dissolve poorly, reduced taste perception. So basically, if you notice the picture, which is in the Guyton book, which is the book for physiology, page 60, 677, figure 54.1, you'll notice that this is the taste receptor cell, right? And it has microvilli. These microvilli are exactly the points where those chemical stimulants will attach, and then a person will be able to perceive the taste, right? But what does saliva? Then here comes a very important role of saliva. What does it do? It washes away these chemicals so that there can be enough room. Now this will be empty, and that's when the stimulus is removed. So saliva have a very important role. Saliva has a very important role to dissolve those testings so that the stimulus can be removed. Increased taste threshold, stronger stimuli required to perceive taste. Common functional effect is hypogeusia, reduced taste sensation, especially for taste and salty taste, sweet and salty taste. So one line summary would be, with aging, taste buds undergo degeneration, reduced number and regeneration, leading to increased taste threshold and hypogeusia. So you can just mention that there is decrease in the number of taste buds. There would be a decrease in the in the number of gustatory cells, which is for reception. There would be decrease in the regeneration of the taste cells. Then even the papillae, there are, atrophy. There would be reduced blood supply. The saliva secretion, that's also decreased, because of which the intestines, they dissolve poorly. For taste, threshold increases greatly, and then, yes, that's about it.